Professor David Gardner is going to be moderating our panel today on outsourcing and privatization of both ICE facilities and corrections facilities. And I'll let David introduce folks.
All right. Well, first of all, thank you all for being here on a Friday afternoon. It shows your commitment and engagement to these sets of important issues. So I want to just start by suggesting a few reasons why this is an important issue, which you're probably already convinced, and throw out a few statistics, and then really leave it to the expert panel that we have today. I think it's going to be a great discussion. So why does this set of issues matter in terms of outsourcing and privatization, not just of prisons, but also of detention in terms of the immigration context? Well, it matters when we think about cost to taxpayers. That's going to come up. It matters when we think about public safety. That's going to come up. It matters when we think about issues of accountability, and we're going to have interesting conversation about that, I'm sure. It matters also because underlying it are different theories about how you ensure efficiency and accountability. Through market discipline, through transparency, through public oversight, and hopefully we'll have interesting conversation on each of those issues from diverse perspectives. So let me just lay out a few statistics to kind of get things going. In terms of immigration detention, 68% of immigrants detained in Arizona are held in privately run facilities. ICE, which is the Immigration and Customs Enforcement, detains 3,000 immigrants on any given day in Arizona. And of the total, nearly 400,000 detainees nationally, the cost overall for detention is in the neighborhood of $2 billion. Interestingly, the Department of Homeland Security has announced a plan to transform how it does immigration detention, and that may come up as well today in our discussion. Turning closer to home to sort of Arizona prisons, 13% of state prisoners in Arizona are now held in privately run facilities. There's been a rapid growth since 2003, and the legislature expanded privatization in 2010 further, and that will probably be part of our discussion today, as well as the recent, that's December 2011, report of the Department of Corrections regarding the difference between private and public provision. And to give you a ballpark figure, it's around $1 billion in terms of spending on prisons in Arizona. So with that very brief overview, I want to now introduce our distinguished panel. To my immediate left, we have Dora Schreiro, who is the Commissioner of New York City Department of Corrections. She was previously a special advisor at the Department of Homeland Security to Secretary Janet Napolitano, and served in the capacity as the Director of the Office of Detention Policy and Planning. She also previously, here in Arizona, served as the Director of the Arizona Department of Corrections. To her left, we have Arizona State Representative John Kavanaugh. Am I pronouncing it right?
Close
okay.
enough. For government work.
For government work. Who represents a district which covers most of Scottsdale, Fountain Hills, Tonto, and Rio Verde. He is a professor of criminal justice at the Scottsdale Community College and director of the college's Administration of Justice Studies and Forensic Science program. He previously taught at Arizona State University and served 20 years as a police officer with the Port Authority of New York and New Jersey Police Department, retiring as a detective sergeant. To his left, we have Catherine Isaacs. She is the program director of the American Friends Service Committee's Arizona office. Carolyn Isaacs has worked for the American Friends Service Committee since 1995 with a focus on criminal justice issues and has conducted original research and advocated for policy changes here in Arizona. Included in that research, she is the author of a report on the performance of for-profit prisons in Arizona entitled Private Prisons, the Public Problem. So we're now going to hear from each of our panelists for about 7 to 9 minutes. We're going to have a little discussion within the panel, and then we'll open it up to all of you to take your questions. So I guess we should start with you, okay. Commissioner Schreiro, since you're right next to me.
Well, good afternoon again. In the course of today's conversation, I've spent a little bit of time talking about those 7 buckets, those 7 areas of competencies that correctional systems need to evidence so as to maintain constitutional conditions of confinement and to otherwise comply with state and federal law. In the time that I've left ICE, I've reflected further on some of the discussions that continue to this very day. One that I touched on earlier, which is that all of the 33,000 beds that are occupied by individuals under the authority of ICE on a given day, that all of those beds are operated either by sheriff's departments or by private prison providers, and in a number of cases, actually both. You'll have a sheriff's department that will have built a facility, but then look to the private sector and subcontract with the private sector, who will then operate those beds on behalf of the sheriff's department. So, but in none of these instances do you actually have ICE operating its own facility. And for those who have concern about privatization, or if it was operated by government today and had concerns about how it's being operated, whoever it is that's doing it, these are 3 points that I want to make, and are a continuing consideration on my part of the places that I had the chance to observe. At the end of the day, a system, whether it's civil or criminal, does well because it has 3 characteristics in common. And so this is my own kind of topology, so bear with me on this, and maybe you can add to it and make it better. First, that a system, civil or criminal, that runs well must have capacity. And by capacity, what I'm talking about is its infrastructure, that it has to have all of the written instruction, the policies, procedures, even the post orders, so that its vision and its mission are articulated in ways that can actually be carried out by every person in every post anywhere in the system. That it has to have a physical plant that is congruent with the underlying assumptions. And for those of us who have done this for some time, when you have a physical plant that works contrary to the organizational objectives, it's not impossible, but it is that much more challenging to accomplish. And we were fortunate in the last panel to talk some about the physical plant and whether it makes it easier or more difficult to accomplish its activities. The personnel also is part of that infrastructure, that they have to have the knowledge, skills, and abilities to perform the duties that they are charged to do, so the organization in its entirety can accomplish its goals. And what we've seen and heard from various speakers is that capacity is something that ICE has struggled with. Those early examples about not having a detainee locator system, which is just fundamental to a correctional system, is one example. Competency is the second of the 3 components, I think, that are really critical to a system doing well. And competency has to do with performance, day to day, its consistency or the extent to which it is erratic. It is the degree to which it is consistently effective and efficient. And where you have great swings in performance or great disparities shift to shift or facility to facility or region to region, then your competency is diminished. Competency also really moves the conversation in the context of accountability and transparency that we had earlier today, to focusing less so on outputs and more so on outcomes. Are you actually achieving the results that you want to achieve? And in commenting earlier about the name change from detention and removal operations to enforcement and removal operations, the focus, the outputs, and the outcomes has to do with how many people are being removed and at what cost and at what speed, and detention as a significant responsibility of government, in this case the federal government, is then it's not raised up in a way that people can have meaningful conversations about it, because the critical indicators that you would collect to measure success, for example, in a correctional system, are not being collected and measured in the system of civil detention. Competency also speaks to a system's willingness to innovate. Is it a safe place to take calculated risks with the goal of achieving good, indeed more than minimal results? And because all systems, the most best intended and the most competent, still make mistakes, whether or not they view mistakes as opportunities for improvement or something to distance oneself from. Competency really speaks to being proactive. It's an approach to problem solving, looking to look for root causes of real concerns and to tackle them. I guess that's my answer to Ruthie's question from the last panel. It's to do things because good organizations strive to become great, and great organizations recognize that great is fleeting and that it requires continuous effort to sustain. The third of these key components of a viable system is commitment. And commitment really speaks to the constituency. Who is your authorizing environment? If we are in government, our commitment is to the people that we serve, the people who pay our salaries, who fund. And so commitment is to constituency, and that means it's not just one part of the whole, but all of the parts of the whole. And what I've observed in my years in government is where there is an imbalance in the conversation, where one constituency has a bigger voice or a friendlier ear than another, then there is greater risk for imbalance. And commitment and constituency also speaks to the purpose for today's conversation, that all of us enjoys rights, but all of us also bears responsibility for a system being what it is. And so whether we're on the inside or on the outside, we all have obligations and we all have opportunities to keep it good if we think it's good, and to make it better, because that's what the American public does. It strives to make things better. The reason that I've gone through all of this is to say, coupled with the examples of the things that ICE has been struggling with to create in its system, that correctional systems largely take for granted, is that in order to pick good providers, whether they be not-for-profit or for-profit or government operators or others operating on behalf of government, that you have to have this kind of infrastructure. And because ICE has largely been an enforcement organization, it lacks some of those knowledge, skills, and abilities to do this other very important governmental function. I think it's remarkable, and I say this with great heart, that over the years and early in its inception, because ICE is not very old as an organization goes, is when we as a nation moved ever so quickly from catch and release to catch and remove as our major immigration strategy, that we went from 4,000 beds to 34,000 beds. It seems like a blink of an eye. And so there was this rush to find space to meet this market shift in mandate. But in that process, there was much that was skipped over. And so as I've mentioned earlier today, this is an occasion both for inventing as well as imagining anew and reinventing what it is we're going to do and how it is that we're going to get it done. But for those who would just say, just get rid of the privates, without those knowledge, skills, and abilities within the government, how do we know what it is to ask for? How do we know whether or not we got it? And how do we know whether or not to sustain it? There has to be expertise within government to do these things. Some of the recent reforms, some of them included in my report and recommendations, has been to grow this capacity inside, to rely, for example, not just on the private sector to evaluate all of the facilities, because if someone else is doing this for you and you don't have the expertise to read what somebody else is saying to you, how do you know whether or not they're any good? Much less those operators of facilities who are doing this on behalf of government. And because the facilities operated by sheriff's departments have had many of the same results as has the private sector, this isn't a conversation about public versus private. It's about, is it sufficient to meet our expectations for civil detention? So I just opened it up a little bit, and I can come back in the Q&A and talk more specifically about whether it's a sheriff's department or the private sector, how to get a better result for us.
Great, Representative.
Thank you. Well, as I'm sure you all surmise from my accent, I was not born and raised in Arizona. I was born and raised in New York City. And almost every day I would observe, a large garbage truck coming down the street with three men, a driver and two people in the back who would go to the curb, pick up the garbage, put it in the hopper. And I was protected by the New York City Fire Department, had friends who were firemen. And in 1993, when I retired from my police job, I moved to Arizona, to Fountain Hills. And I was amazed. When I got up in the morning, I saw one person in a garbage truck drive down my street, stop in front of my house. I saw a claw come down, grab the can, throw it in, and he drove away. One person doing what three did in New York City. And I can assure you, the one person in that private garbage truck was not getting 90% of the pay that a policeman gets, which is what the New York City Sanitation Department contract called for back when I was there. I also discovered that in Fountain Hills, my fire service was being provided by Rural Metro, a private company, along with ambulance service. And it was just as good as the public service. In fact, I helped work my way through college, driving and attending on New York City emergency ambulances. And I can tell you that the Rural Metro service that we get now in Fountain Hills is far better than the ambulance service that I was involved with in the late 60s. But New York City's improved also, so I don't want to be unfair. My whole point is, there is nothing inherently good or evil with privatization of things, just like there's nothing inherently good or evil with a government running something. There are some great government prisons, there are some horrible government prisons. The poster child for horrible prisons is a prison called Attica, which had a horrible riot back in the 1960s. That was a government-run prison. So there are good government prisons, there are bad government prisons, there are good private prisons, there are bad private prisons, and you know what? In both categories, most of them are kind of right in the middle. There's nothing inherently good or bad. So I don't have a problem with privatizing when it's appropriate and when it's in the public's interest. Now, I draw the line at certain things. I do not believe that the enforcement arm of government should be privatized. I wouldn't want private police. I wouldn't want private tax collectors. I wouldn't want a private military overseas. I think when it involves force and the consequences, it has to be totally controlled by the government. But outside of those areas, I don't see a problem with privatization. My doctor is a private person. I rarely go to government hospitals and government clinics. I'm not saying they're bad. They do a good job too. We got a great burn center here in Maricopa County. But neither is intrinsically good or bad. The bottom line is, a private facility can be great as long as the government agency which is contracting clearly puts what has to be done in the contract and has effective monitors on site to make sure that it's done properly. And that's exactly what Arizona is doing. We have been contracting with private prisons, not for all of our prisons. The studies show that private prisons seem to do better with medium and lower security, don't have as great a track record with maximum. I'm not sure why, I don't know if it's true, but we've just been privatizing the medium and the lower security prisons. And we do it because it saves money. And that's in spite of what you're hearing about this study. And this might be a good opportunity to clear the air about the study that says that privates cost more money in Arizona. They do not cost more money in Arizona. Yes, a Arizona Department of Corrections study said that. And yes, we in the legislature said, stop doing that study. And let me tell you why. For years they did that study, and it showed that the public prisons were cheaper. For years we said, this study is flawed. You are not putting the appropriate amount of money in for construction. You're not putting the appropriate amount of money in for legal fees that you pay. They were undershorting some of the factors. And we asked them, and another, the biggest factor, they were not putting the correct costs for the pensions of the public workers. Our pension systems are grossly underfunded in Arizona. And in addition, not only are we grossly underfunded, only around 73%, in addition, our funding levels are based on absurd projections of 8% returns going out 30 years. When the federal government is saying you got to do 4.4%, Moody's is saying 5.5. So I asked our budget people to take the DOC study and to plug in the correct figures. Put in the correct figure for the pension, for construction. We have not yet gotten a legal fee figure, but that will be minuscule. But when you rework the numbers, this is the comparative cost per day of public versus private. For minimum custody beds, state cost $58.56 a day, private cost $46.56, 20% less. For medium custody facilities, state cost $60.39 a day, private cost $53.02 a day, savings 12%. That's when you factor in true construction costs and the pension. So, and that's why we did it. We didn't turn around and say, let's spend more money on private prisons. We said, we can save money here. And the studies consistently show that private prisons can perform. I went online, I took a look at a study by a Reason Foundation, admittedly a free market institution, but they looked at about 20 studies just prior to 2002, and about 15 said private prisons are as good or better. Now I know that they're on one side of the argument. There are also studies that say that private prisons aren't as good. I looked at the Urban Institute's public management director, Harry Hatry. He said that private management companies can efficiently run lower security prisons, but have less effective in providing adequate results in maximum security. And the Urban Institute is not some right-wing think tank. The bottom line is, there is clear disagreement in the studies over whether private is better than public. And the bottom line is, I think, because in some situations the privates are better, and in other situations they're not better. And it all comes down to what kind of a contract do you draw up in terms of making them give certain levels of services, and do you have inspectors there to make sure they're fulfilling that contract? And if you have that, they can save you money. Because private prisons save you money because of a lot of different reasons. There are greater efficiencies in the private sector, because they have a mission or a goal to make cash, and they go out of their way to, so there's no garbage strike, so that the people won't get all upset, and they won't be thrown out of office next election day. My concern is getting the best deal for the taxpayers in terms of money. And the private sector's concern is not political, it's to get the best cost so they can make the best profit. And there are other reasons too. There's more innovation, they have lower employee costs. I can assure you, a private sanitation company is not giving their people 90% of the salary of a cop and fireman because of a political deal with unions. And the benefits are far less. You have cities in California today declaring bankruptcy because their pension obligations are so monumental, it is crushing their budgets and preventing them from spending money on other services. That's how bad the public sector employee, unfortunately, is pricing him and herself out of the labor market. And my responsibility is to do the best deal for my taxpayers, my constituents. And that sometimes involves privatization, then we will do it as long as we have proper standards and we have proper monitoring. And there's more flexible work rules, less political influence. There are a lot of reasons. I'm not saying that blanket private's better than public. It just depends on the situation, the agency. You get a good contract, you tell them what you want, you have monitors, and it can work. It does work, and it can be cheaper.
Thanks. And now we'll hear from Carolyn Isaac.
Thank you. So the American Friends Service Committee, excuse me, has followed the rise of the for-profit prison industry in Arizona for about the last 15 years. We recently, as has been mentioned, released the state's first ever comprehensive state-based assessment of the cost and quality of our public versus our private prisons, specifically in Arizona. And one thing that I want to make sure everyone understands is the landscape in terms of privatization in Arizona. So we have 5, now about to be 6, private prisons under contract with the State Department of Corrections to hold Arizona's felony level prisoners. Then we have 6 facilities that are simply located in Arizona, but which import prisoners from other states. So California, until recently, the state of Washington, and then the federal government. So that's where you find those ICE detention beds, in addition to the ICE centers run by ICE and the Pinal County Jail, which was mentioned. And so we attempted in this research to try to look at that entire landscape in Arizona for the first time, to say, what data is there about cost? What data is there about the quality of those services? And the first and really most important thing that we learned is there's hardly any. We were absolutely flabbergasted, that it took a small nonprofit to endeavor to do this for our state government when they're continuing to invest millions of dollars of tax money into this system every year. And B, how hard it was to get any solid data to evaluate. Are they costing more? Are they costing less? Where and how? And so I wanted to try to provide some data for you about ICE in particular, since that's really the subject of discussion today. Unfortunately, that's where our report really was the weakest. It's important to understand that as private businesses, for-profit prison corporations are not under any obligation to share this information with the public. In order, if you want to know about the Arizona Department of Corrections, you put in a FOIA, right, the Freedom of Information Act request to get that data. You can't do that for Corrections Corporation of America. And so what we had to do was try to FOIA the governments providing the prisoners, right? So we FOIA'd California, we FOIA'd Washington, we attempted to FOIA ICE and got no response. So what we have in here about ICE is very limited, but I'll try to share with you what we have been able to find. On the issue of cost, there's actually a very interesting article that just came out in the Associated Press that ran in the Houston Chronicle. And it features a startling revelation that according to Gary Mead, the ICE Executive Associate Director for Enforcement and Removal Operations, the federal government has never studied whether privatizing immigrant detention saves money. So we don't know. In other words, ICE is paying, according to this article, $166 per day for each detained individual, but has no idea whether this price is justified. I am very anxious to take a look at the data that Representative Kavanaugh has just cited. I think that it is very encouraging to me that our state leadership is now really taking this effort to take a look at the associated costs, to really have this conversation about, are we saving, are we not saving? I don't know whether Commissioner Shiro may have something to say about those studies from the state, since they were initiated under her leadership. But the bottom line, as Representative Kavanaugh mentioned, is we have very little data, and what there is fairly conflicting. What we tried to do in this report is to see what were the promises that we were made in terms of privatization, and have they come? So one of those promises, of course, is that we're going to save gobs of money. I have not seen any evidence that that is the case, and I'm interested to see what Representative Kavanaugh has brought. The second is, are they providing a higher level of quality or safety to the public? Right? Certainly in terms of state prisons, the bottom line is about protecting public safety. So what we were able to learn in terms of ICE detention, again, is very limited, but very concerning, and certainly Victoria has spoken to the report that the ACLU put together regarding our immigration detention here in Arizona. The ACLU nationally has documented over 200 documented complaints between 2007 and 2011 of sexual abuse of immigrants in ICE detention centers across the U.S. 16 of those incidents that were documented occurred in Arizona, and half of those were in CCA's Eloy Detention Center. Again, that's a mixed bag, right? ICE has privately and publicly operated facilities. It's a problem throughout that system, but the proportion, at least in Arizona, is very much skewed toward looking particularly at the Eloy Detention Center as a really problematic facility. In addition, the Eloy Detention Center had the highest number of deaths of any immigrant detention facility in the United States. That's 10 since 2003. And those deaths were only discovered basically because of a Freedom of Information Act request and lawsuit to enforce that was brought by the ACLU. A 2008 Washington Post investigation into medical care in immigrant detention centers found, quote, a hidden world of flawed medical judgments, faulty administrative practices, neglectful guards, ill-trained technicians, sloppy record keeping, lost medical files, and dangerous staff shortages. It is also a world increasingly run by high-priced private contractors. There is evidence that infectious diseases, including tuberculosis and chickenpox, are spreading inside the centers, unquote. And again, I do want to point toward that report by the ACLU specifically on facilities in Arizona for more details. And of course, here in Arizona, we, in our state prison system, have had some pretty spectacular failures in recent years in terms of our for-profitly run facilities. Of course, in the summer of 2010, we had an escape from the Kingman facility run by MTC. 3 folks broke out of there, went on a 2-week multi-state manhunt that culminated in the deaths of 2 people in Oklahoma. Shortly after that, security audits were conducted by the Department of Corrections on all of our state prisons and all of our privately operated prisons. And as Bob Ortega has written so well about in the Arizona Republic, what those security audits revealed was a startling pattern of safety lapses in all of those privately operated facilities. Malfunctioning cameras, alarm systems that didn't work. In Kingman, the alarms had not been working for 2 years and had not been fixed. Right? The guards were propping the doors open with a rock. And we saw that again and again in all of our privately operated facilities. A year out from that, in 2011, the State Auditor General again went back in, did another security assessment, found 157 security failures in the 5 private prisons under contract with ABC for just the first 3 months of 2011, including malfunctioning cameras, doors and alarms, holes under fences, broken perimeter lights and cameras, and inefficient or outright inept security practices across the board. So one of the patterns that we see in terms of for-profitly operated facilities is in the area of staffing, and this is something that Representative Kavanaugh has alluded to. So how do you get a contract if you are a for-profit prison company? By being the lowest bidder, right? So you want to be the lowest bidder in order to get the contract, but you are going to run a facility with the same people in it, with the same basic needs, and yet you're also going to skim a profit off of the top of that for your shareholders and for your CEO. Where are you going to cut those corners? You're going to cut those corners in staffing, staff pay, and staff training. Certainly not going to pay pensions or allow people to unionize. And you're also going to cut those corners in terms of the programming that you provide to the prisoners in that facility. Those issues have been found at the root of a number of systemic problems that we find again and again in for-profit facilities. When you see a major riot, an escape, other kinds of disturbances or major security problems, you very often see this pattern of low-paid, green workforce, there's a high level of turnover and staff vacancy. So you have folks that really haven't been on the job very long, who haven't received a lot of training because that's very expensive, and this is where you tend to run into problems. And so that really is something that we see that is endemic to privatization in this particular sector, and it is a concern. And the third piece that we found as really a trend in our research was the issue of accountability and transparency. So again, as I mentioned, as a for-profit business, you are not required to provide the same level of transparency. You don't have to make your record public, your staff pay, your budget, your operations, and the rest. So there's really an alarming lack of study of the cost, safety, and performance in terms of these facilities. I absolutely agree with Representative Kavanaugh that all prisons have problems. I want to be the first to tell you that the Arizona Department of Corrections should not be the baseline of any comparison of quality for a correctional facility, right? We have huge problems in the state of Arizona. I mean, the ACLU is in the process of bringing a major class action suit against the Arizona Department of Corrections for systemic denial of medical and mental health care, and for obviously not proven to be true. You're taking a huge state bureaucracy and you're inserting a corporation, or in this case, multiple corporations, into that bureaucracy. So then they have to learn how to talk to each other. They have to figure out what the lines of communication and decision-making are going to be. You need to hire those monitors. You need to oversee the contracts. You need a legal team to review the contracts. And so really what we're doing is complicating a system that has major, major problems and really providing a way for them to basically cover their tracks, certainly in terms of the medical care. That's one of the concerns that we're seeing right now. The difference is accountability, right? It is exceedingly hard, you can ask Victoria or anyone else, it's exceedingly hard to hold the Arizona Department of Corrections or any other state agency accountable for its failures. Very, very hard to do. It is 10 times harder to do that when you're talking about a for-profit agency that is subcontracted with that department. And to hold them accountable, first you have to be able to get a hold of that data, which is very difficult to do. The last thing that I want to say in terms of the issue of accountability and transparency is we got to talk about the money, right? And we have to talk about the politics. Because it was so hard for me earlier in the discussions about like, well, this is civil detention, and why are we holding these people in facilities that are like jails when they could, they haven't committed any crimes and they pose no risk to the community? Why do we continue to incarcerate them? I'm afraid that a large part of the answer to that is politics and money. So if we look at the numbers, right, from 2005 to 2012, the ICE budget doubled, right? $864 million to over $2 billion today. Our detention system went from 18,000 beds to 34,000 beds, right? Half of those are privately operated. In Arizona, it's higher, it's 68% in Arizona. In that same time, Corrections Corporation of America went from spending $500,000 a year on federal lobbying to no less than $1.8 million per year. $4 million on lobbying in 2005 alone. ICE revenues to CCA went from $864 million in 2005 to over $2 billion. This is a huge, huge industry for them. And they have an absolutely vested interest in continuing to see the increased use of detention beds and the increased funding of detention as an approach for ICE. We see huge expenditures on lobbying, on campaign contributions, and we see that money trickling down to local communities. And if you haven't yet, you've got to read this article that Chris Kirkham wrote in the Huffington Post a little while back, specifically about Pinal County, Arizona, and how CCA, basically revenues from CCA, is essentially funding their county government, right? So CCA pays Pinal County government $2 for each inmate or detainee in its prisons. Last year, that amounted to $1.4 million to Pinal County. That money, in part, funds the county sheriff's office. which has an agreement with the federal government to act as an enforcement agent on immigration law, arresting violators, referring them to federal authorities. So the sheriff's enforcement actions influence the size of the prisoner population, which in turn increases the amount of revenues that they're receiving from CCA.
Great.
I think I'll leave it there.
So you've clearly, I think, engaged the other panelists, so why don't we give a brief kind of time for rebuttal to first Representative Kavanaugh and then Commissioner Schreier.
Thank you, and I'll try to
If
make
you
it
have
kind of quick. I'll quickly respond to the 37 points of disagreement that I have. First, I think it's unfair to say that Arizona DOC is a mess. Well, like all systems, it has problems, but I've toured a number of facilities, and I don't see anything that comes close to it's a mess. I think that's a little overstatement. Part of the problem is money, you're correct. To get by the fiscal crisis that this whole country and world has faced over the last few years, the Arizona budget assumed $3.7 billion in general fund debt, and we've deferred $1.2 billion in rollover payments. That's almost $5 billion in a budget which is $8.5 billion. The debt is humongous, the economy is in slow recovery. So we're focusing more on need to have as opposed to nice to have. So that's one reason why you don't get everything you want. In addition, look, listing a litany of bad incidents in private prisons does not mean, and you alluded to this, that public prisons are great. Because I could sit here and I could give you the exact same litany of problems in our public prisons. We had a riot 2 weeks ago down in our Tucson facility. California had a riot this week. Right? I mean, the incidents occur everywhere. But I don't use that as an argument to privatize all of Arizona's prisons because we've had incidents. We had the incident in Lewis with the hostage situation. I didn't jump up and say, public can't do this, privatize them all, because isolated incidents are not the things good policies are made of. Kingman is an interesting example, and it shows you that the line between public and private prisons is not always a clear-cut black and white line. There's a blur. I was pretty outraged at what happened at Kingman, and much of the problem at Kingman was procedures and operating procedures. Having all the guards at the end of the shift mosey over to the exit gate to get out early, which is absurd, right? There were physical failures too, but we got physical failures and problems with locks in our own DOC prisons even to this day. But I said, how could this happen? And I'm talking to Director Ryan, who I have a great deal of respect for. I think he's doing a great job. And I discovered that we had full-time, on-site DOC inspectors at Kingman who were observing all these operational failures. And guess who was running Kingman Prison, the private prison? They were almost all retired AZDOC wardens and deputy wardens. So as you can see, it's not them and us, or private and public. There is tremendous blurring and overlap here. And these tends to be failures that can happen in any prison, which I think is the whole point that I'm trying to make. It's not this way or the other, and we do save money. And by the way, let me be the first to give you the revised data, and if you want details, I certainly can give you that. You made allusion to the fact that, we won't give them that much pay, we won't give them pensions in private prisons. They give pensions in private prisons, but they're not platinum pensions. They're the pensions that people like you get, and they're more reasonable. And as to the incarceration numbers, why do we incarcerate? I think you were referring to ICE, and I don't deal with that. But I'll tell you why Arizona incarcerates, because we got some dangerous people out there. 95% of the people in Arizona prisons are multiple offenders or violent offenders. You only have 400 of 40,000 prisoners in Arizona who are drug possession only. I'm not counting drug traffickers, which are a different case. Right? So this myth that we have a bunch of non-violent prisoners and we can empty 20% out tomorrow is just not true. 95% are repeat offenders or violent criminals. Only 400 are lower level narcotics possession people. And we keep them in so they don't live next to you.
Commissioner?
Wow. So I'm going to stir the pot a little bit more. A little bit more, I said. Arizona has an extra dynamic here that I think is worth talking about. There are private prisons that the state contracts with, but there are also private prisons in Arizona that have no relationship with Arizona. You had land that was available, it got bought up, particularly by CCA, and as Carolyn, as I think the representative had mentioned, has housed state inmates from other jurisdictions. When I was here, it was Hawaii, Alaska, I don't know, it was Washington at the time, or one of the northwestern states, and it's changed over time. And in the time that I was in the state, there were the occasional incidents that were so significant that it became known to the public at large. And one of the interesting, not necessarily in a good way, things that comes from the private sector running prisons in our state, not dealing with our inmates, is when something bad happens, the state can't go into the facility. They can't conduct their own investigation. They can't ascertain if the conditions are safe to continue operation or to temporarily suspend operation. And it's interesting because almost any other business has to go through some licensing, and it has to meet certain requirements. And even the transporting of the prisoners from one jurisdiction into and then out of ours, still thinking like an Arizonan, that you don't know when they're coming and when they're leaving, and the means of transport. And anything else that's transported through the state, is usually licensed by DOT. And I'm being careful not to suggest that inmates are like a dangerous substance, but they do present risk, and also depending on the jurisdiction and how they handle health care, whether or not they're introducing individuals who have an infectious or contagious disease, or any of the other considerations you would have about any other business. And
If I may, there were 7 bills introduced this past session that would have addressed that issue, and none of them received a hearing.
well, we were introducing them when I was still here. So so that's yet another dynamic about why some industries do what they do, and that some jurisdictions are more hospitable or appear to be hospitable than others. And when we're talking about accountability, this is certainly relevant to that conversation. The private prisons in the state, and I'm only going to talk about the time that I was here. My experience is that they were not faster, better, cheaper, and we did studies. We didn't do studies. We actually commissioned studies by conservative accounting firms that did those studies on behalf of government. Not all low custody, not all medium security are the same. You have individuals who have not only present risk but also present need, and so individuals who have medical needs would be the types of inmates that would not be assigned to the private sector, nor did they have the healthcare facilities to handle high-cost inmates who had those special medical requirements. There was a period of time where sometimes legislation occurred through appropriation, and monies were expressly appropriated to a private facility but in another state. So we were being directed to place Arizona inmates in another state when there were other beds here. And that practice had discontinued before I left, and it sounds like it has not resumed, and that's a good thing. But all of these are forms of transparency, and these are all various components of accountability.
Great. So I want to now just ask questions. Let me start first with you, Carolyn. So I know you haven't had a chance to read the report the representative handed you, but let's just assume, for the discussion, that once you build in those costs on pensions and other things, that really private is cheaper, okay? And I want you to assume that because you have 2 arguments, if I understand it. One is about the price, and that's clearly contested in terms of the facts. but the other is about accountability. So what would you recommend to the legislature that they do in terms of the oversight piece of this, if in fact we are getting a bargain with private prisons?
Well, I think that we certainly, if we're going to have these contracts, and it's a long haul to get yourself out of them once you're in them, then there are absolutely many more accountability measures that could be built into those contracts. We've actually got a set of recommendations in the old report about those in terms of assessing liquid damages when a contractor is out of compliance. Some other great ideas that we got from the Director of Corrections from the state of Oklahoma. But I really want to caution that even when you have the capacity to hold a contractor accountable, there are often other factors that prevent your elected officials or even your DOC from doing that. And the best example that I can give is, again, the Kingman example. So, and another tip of the hat to Bob Ortega for being the one that actually revealed this to the people of Arizona. But after Kingman, and when DOC, discovered the security lapses there, a series of memos went back and forth between MTC and the Department of Corrections about, gee, could you fix the alarm system, please? Oh, yeah, we're going to do that. You haven't done it yet. Yeah, we're getting around to it. Okay, when are you going to do it? Oh, we did it. No, you didn't, right? So for like over a year, these memos go back and forth. And finally, the Department of Corrections says, okay, we're going to pull 200 of our prisoners out of this unit until you fix the security problems in your prison. And that means we're not going to pay you the per diem for those prisoners, right? This would be a logical measure of accountability for any Department of Corrections. Does MTC say, oh, we're so very sorry, we'll fix that problem right away? No, they threatened to sue the state of Arizona for $10 million for breach of contract because they have a 97% occupancy guarantee for that prison, right? So even when you have, clearly our monitors were asleep at the switch, there's no question about that. There are some very powerful political and economic factors that really put a lot of pressure on your Department of Correction, on your local governments against holding these contractors accountable, and it can be very, very difficult to do that even when those measures are.
So let me turn to you, Representative. So you started off with a very powerful example of the three-man garbage truck, and I wonder how transferable that example is from New York to Arizona, and more specifically from garbage to prisons, right? Because we know that the one thing that mayors get voted out of office for is for poor garbage collection, right? And people are up in arms, and they have mechanisms to express their displeasure. Now, in the prison context, those who are most directly involved, the customers, if you will, don't have any of those mechanisms of accountability. So the burden seems to be much higher than in the garbage context in terms of building in structures of public accountability. You suggested that can be done in these contracts. So what are you doing now, or what more should we be doing to try and address some of the concerns that Carolyn's raised?
Well, first, let me just clarify. This study, or the new data, we took the Department of Corrections study, the Joint Legislative Budget Committee, which is a nonpartisan legislative civil service budget people, much like the government GAO, okay? And they're respected by both sides of the aisle. They're the ones who did this analysis, and it's very straightforward, so it's really no games. Well, I think the fact that you had 3 people getting paid 90% of what it gets a cop to pay, that's why it was ridiculously expensive, and it's much cheaper here. And you see the same thing in prisons. One of the reasons why this cost is so great is the unpaid pension liabilities. When you put that in, that's like $10.71 of a $58 cost. 1/6 of the cost is just the unpaid pension liabilities. So you don't have that type of excess benefits in the private sector. Now, the problem with monitoring becomes really difficult, and you have to rely on good DOC people. Because we have a situation now where we have a healthcare company that we brought in, Wexford, to provide healthcare. And out of nowhere, the DOC turned around and said, yes, let's privatize. I almost fell off my chair about 18 months ago. They were resisting. We go into a meeting up in the governor's tower, and they say, let's privatize. And I was like, really?
Did you pass a bill that mandated them
they dropped their opposition.
Oh, I see.
And that probably wouldn't have got, and if they opposed it, we don't think that would have gotten through in the budget, but beyond that. So they do the privatization, they do the contract, and Wexford calls and says, hey, they've got over 30 monitors. And other states have, like Illinois has 45,000 prisoners, they have 5 monitors. Maryland has 28,000, they have 9. Mississippi, 15,004. And we suddenly have over 30 monitors. And Wexford said, we see problems here, because, when you have 29 people whose job depends on them finding problems, they're going to be finding problems where problems don't exist. And they're going to be supervising, not monitoring. And that's one of the problems when you have people from DOC doing the checking. You have to make sure that you're getting, you're getting impartial monitoring. And that's something which people get concerned about, and I'm a little concerned about. And maybe we need monitors that are just neutral and divorced from either side of this debate. I don't know how you solve it, but the monitors need monitoring, because you can have unbiased monitoring, and that becomes a real problem. Great jobs for your people, and escapes are so rare, but that's part of the problem. So, you have to have good monitoring, but you have to have fair monitoring. And I might have to, defer to people in business and management courses as to how you construct something like that. But the private sector very oftentimes feels that the public sector monitors are gunning for them. And I'm not sure how true that is, but there's a perception, and it's something we need to deal with.
So Commissioner Ney, you've had experience in a number of different contexts. I'm interested in your thoughts on this accountability. You highlighted transparency and maybe ways that we could expand the transparency. But I'm also interested in your thoughts on the underlying problem, both here in Arizona, but also in the ICE context, because you highlighted in work you did for DHS the fact that there was a bit of a mismatch between the detention of aliens in pretrial and felon detention settings, when actually civil detention settings would be cheaper and potentially a better fit. So I guess I'm wondering, in the ICE context, have we done enough, or what do we need to do to move in the direction of a lower cost model generally? And in the prison context, are there models out there that you've seen in other contexts that we should be trying to apply here in Arizona?
Yeah, it's a mouthful. What is happening now in ICE, and these are all good things, is they have created they've regionalized special audits so that they're closer to the areas, and so specialized teams, which include medical personnel as well as custody management experts and all. So it's a multidisciplinary team. They're within a region, and they can respond rapidly to special situations, but also maintain a regular schedule of audits, inspections, and assessments. For those facilities that are fully dedicated to ICE detainees, which, by the way, is my preference, my experience has been that where facilities are shared and become mixed use, it's usually the ICE detainees that get the short end of the stick, and we've heard that in different ways from people today. And so you would have individuals with expertise on site 24/7. And of course, the danger is, as Representative Kavanaugh said, is they have to be good. The thing is, it's easy to become overtaken. You come in with one identity, but you share time and space and develop relationships at an offsite, and next thing you know, it's home. And so some of the neutrality that you came with is harder to maintain, and so that's a challenge always that goes with this kind of responsibility. But as I mentioned before, having clear outcomes identified and having benchmarks for measurement is really critical. There are different kinds of missteps that occur, and many of them are unintentional, but still can have significant consequences. In government, both states and the federal government, they have things called COTARs. These are the contract managers, and rarely are they subject matter really do they have expertise in the subject management for which they are managing contracts. And so some of these monitoring firms that ICE had contracts with were requesting reimbursement after the fact for what had been unforeseen and unbudgeted personnel overages. And so the co-tire's response was, pretty linear, which was to say, all right, I'm limiting your hours to business days and business hours. Well, it really goes completely against the idea of monitoring, where you want people to pop in nights and weekends and holidays and off hours. And the minute you limit them in that particular way, you bring your budget back in line, but you really undercut, albeit unintentionally, what you intended to accomplish. So you really, again, have to have people in all facets of the operation having sufficient expertise to carry those matters out effectively.
All right, thank you. So why don't we open it up to your questions, assuming people have any questions. Let's start with you, sir.
Yeah, I had a question. I guess it's Representative Kavanaugh. Talking about the issue of transparency, wouldn't the simplest thing to do be simply to say that if you're going to privatize, that the level of information they have to provide would be exactly the same as what the state would have to provide under FOIA? That would, it would seem, address that problem. Is there any reason not to do that? Because we obviously don't do that.
Well,
in Arizona, for example, and I don't think the federal government certainly doesn't do that with this kind.
well, the Department of Corrections has total access to what's going on.
Well,
They had
right, but the public,
on-site.
but that's kind of the issue.
Yeah, I'm not 100% sure, quite frankly, on what the disclosure rules are for that. So I can't directly address that. Clearly, there should be.
I can tell you because I filed lots of FOIAs.
Okay.
So, just, I'm sorry to engage in too much dialogue with this, but just to kind of clarify. So, with the federal, largely what tends to not be available will be, anything that the state demands that has to do with say, financials. For example, how much they're being paid, what kind of salaries are being paid. That information is not necessarily disclosed. And then a lot of times it's a question of because it isn't necessarily spelled out in the law, what a particular agency, say DOC in this case, but it would be other agencies, obviously ICE or whatever other cases, simply decides, somebody more or less arbitrarily decides that, this information is disclosable or this information is not disclosable.
Well, without spending an hour, what information do you want?
Well, the kind of stuff that we're talking about here is, for example, being able to hold corporations just as accountable as the state when there are issues that arise that may be problematic. For example, you guys were talking about medical care earlier, about Wexford, complaining that there might be too many monitors. There have already been lots of complaints arising about inmates not getting medical care, about a lack of a shortage of doctors.
That was pre-Wexford, because they just took over.
Well, I know, it's literally, it's a huge lawsuit. What I'm saying is, for example, part of what's happened since Wexford has taken over is that they said that maybe this is just part of the transition process, maybe this law gets sorted out eventually, but there have been, issues with, several prisons that, for example, have no doctors on staff at all, and have been trying to hire somebody, but I guess it's an issue of how much Wexford is going to pay for a couple of months, things like that.
Okay.
So and I'm sorry, I don't want to get off.
So yeah, I think
Right.
you.
Let me-
The question is just, what do you think is an appropriate?
All right, let me just respond briefly, because this is more complicated than it seems on its surface. One of the problems right now with Wexford is that they hired over 30, DOC kept over 30 of the employees that were DOC healthcare employees and retained them as inspectors. Wexford said, when we move into most operations, we pretty much hire everybody who's working there now because we like a smooth transition. We don't like to throw people out of their jobs. And we really got the shaft here. Well, they didn't use that term. That's a New York term. But because they took away all the supervisors. They hired them and made them inspectors, and it made it all the more harder for us to get staff. Now, they haven't been there that long, so I don't want to prejudge them. But I'm open to reasonable disclosure. But obviously, a lot of stuff that has to do with personnel and health and stuff is not even open to FOI. But I'm certainly open to greater transparency. I don't see a problem not to have that.
You had a question?
Well, I think I'm the only ex-felon here. Is that right? Anybody else want to raise their hand and say they are?
Anyone?
And so I'm the only ex-felon here.
Okay.
And so I just wondered if there was anybody else that wanted to claim that. And so I'm glad, Mr. Kavanaugh, that you said you're open, because you are going by Dr. Fisher's report about 95% of all inmates being violent and repetitive. I hope you all are frightened because I'm here, because 93% of all inmates will be released from Arizona prisons. And if you just go by Perryville and you look at the way inmates are categorized, there's 7 yards on Perryville. 1 yard is for maximum security, violent offenders. 1 yard is for medium security, and 5 yards are minimum security. And those people are going to get out. So for you to say that we're all violent and dangerous and you're keeping us inside because, well, that's what you said,
No, I didn't say
because we are dangerous and you're protecting the public, I would like for you to consider the classification of the Department of Corrections itself, because they're not classifying the way Dr. Fisher's report is. And so it needs to be adjusted in some way, because it is really giving the public false information.
Okay, well, let me rephrase. Let me clarify. 95% of the prisoners there are there because they've committed multiple felonies or violent crimes. Obviously, they don't all go into max or another high level of security and stay there forever. The DOC has a procedure where you, by good behavior, you get to work your way down so you have more freedom, I'm told. Right? So the fact that a number of people who came in as violent felons maybe 8, 9 years ago have behaved and are now in medium or less doesn't mean that they were never violent felons. My point is, you have to work pretty hard to get into an Arizona prison. Now, I'm not saying, well, yeah, it's the truth, because you have Proposition 200 that says that if it's just drug, I'm not talking traffickers now, and I hope nobody here wants to let drug traffickers out early because they're reformed, but if you're talking just drug possession, right, you have Prop 200. They don't go to prison on the first offense, and most don't go to prison on the second offense. That was a voter-passed proposition. So, again, you look at what they were sentenced for. Have they changed? I sure hope some of them have changed. But I don't want to go back to what we had in the 60s, where we had this ridiculous... that was one of the reasons why you had a riot in Attica. Prisoners didn't know what their future was. Disparate sentencing between upstate and downstate. You know, having more fixed sentences isn't necessarily bad. But the facts I give you are what they went to prison for. I don't deny that some of them have been good and they're down to minimum security. I don't deny that at all. And I'm glad to see that's happening.
That's not the way it works.
Okay, can we get some other questions there? Thank you for your question. Yes, you.
I think that the most important problem which Caroline has mentioned is that if we have private prisons, then we have companies which are earning money on having people detained. And obviously afterwards there's lobbying to having longer detention periods, to having more severe punishment. So I wonder how the supporters of private prisons can address this problem.
Well, I would just say that you can apply that same argument to doctors. You know, I mean, doctors make more money if people stay sick, but they don't do it that way. You know, they don't have, and I don't know how a private prison operator can determine if someone's going to stay longer. I mean, that's usually something set with the judge, and there's very little leeway with truth in sentencing, so.
No, but there is a lobby.
Okay,
of the company.
why don't we get the commissioner's response as well to your question, if you don't mind.
I'm sorry, so say it again very quickly.
Well, basically, if you have private companies running the prisons, then in their benefits, in their interest is to have more people detained and people being detained for longer. And there is
The incentives.
there is
Yeah.
strong lobbying for having the punishments and
You know,
detention longer. So how
It's
do you address
it's
that?
not been it's It's not, I don't have firsthand knowledge, it's not been my experience. They are actively involved in lobbying, but the lobbying is that where there are beds, that those beds be made available to them as private beds. I have not come across, I'm not saying it one way or the other, that they lobby for sentencing change. And that's the only way that you would really create that kind of capacity.
But what I heard is that the fact that, for example, like the fact that migrants are very often detained in the U.S., it's one of the reasons is that there's a strong lobbying on the side of prison companies who it's in their interest to having migrants very easily detained because they are earning money.
So that was something I addressed earlier. Congress in 1996 passed a series of immigration reforms, and they substantially increased the number and the nature of people who either entered unlawfully or remained unlawfully for mandatory detention. But that is an act of Congress that was passed in 1996 that today still plays itself out as large numbers of people who are subject to mandatory detention for violations of civil immigration law.
Did you have any additions, Carolyn, before we move to the next question?
Oh, many. And I know that we're short on time. I mean, I think that there's, certainly CCA, for example, will say, we have a policy that we will not lobby for increased sentencing, right? But that's not what our lobbying for. Our lobbying is for, I don't know what they say it is actually for, but you can very clearly see the pattern, right, and the outcomes of those patterns. If you look at Arizona's SB 1070, for example, right, the governor's two top advisors were current or former lobbyists for CCA. You have CCA Geo Group spending a lot of time and money and energy in Arizona talking to our legislature and to the governor's office. There are very clear relationships, and there's a pattern in terms of how these corporations operate. It's a very smart business model. They wouldn't do it if it wasn't successful in getting them more contracts.
So let me just step back for a second. So we've got disputes about the facts, right? Disputes about the costs, and those are central to this debate. We have disputes about motives, and that's what's coming up in this context. But one area where I was struck that we had at least the potential for some, more constructive dialogue was on this issue of transparency. I think the representative asked, what is your model transparency legislation, and express some openness to it. I tried to get earlier, Carolyn, your specific suggestions on that matter, and I know, Commissioner, that's an area that you've had some experience with as well. But before we get to the next question, I'm wondering if among you three panelists, we have any common ground on that dimension, recognizing that other areas are quite contested.
Yeah. Well, at first glance, to come out against transparency, it would be ridiculous and suicidal. I guess the question I would ask is, what's the current policy? Is Arizona's policy greatly different than what other states do? If so, why? And if this is proposed, how would the private prisons reply? What would their problem be with it? It's a complex issue, but I don't think that people should be denied information without good cause.
And I'll just get super concrete. House Bill 2203 basically boils down to any private prison operating in the state of Arizona, so that would be those under contract and those not under contract, must make available on request all records pertaining to the contractor's costs, operations, staff, and inmates to the same extent required of public prisons and jails.
I would also contend that the reports that we use that determine what directions we're going and what the trends are need transparency also. As we all know who work in any sector, where a report is written and how statistics come out can be very different. And I think that there's a level of transparency there, that where those, who writes that and where those come from can be very different. And The independent observers need independent observers almost.
So if you could just explain for those who have not read this bill, what is different in it than it is now?
That currently those corporations do not have to provide any of that information upon request to public. There may be, and for those that are simply operating in the state and are not under contract with the state of Arizona, they don't have to provide it even if our state government requested it.
How does that compare to New York?
New York is very aggressive when it comes to informational requests, the time that we have to produce requests and the things that must be produced. There is very little that can be redacted in New York. It seems like there's different kinds of transparency. There's the core components of the contract. So what is the fundamental agreement, and it's the four corners, all of its parameters, but then the extent to which it adheres to its contractual obligations, which is the evaluation, which is both outputs to some extent, but more importantly the outcomes. So there are certain benchmarks that would be held constant, whoever it is that's delivering it. But as I had mentioned before, the situation that Arizona is in now, because you have some facilities that are built and operated without input from government at the local or state level and can't respond if it's faced with an emergency, that kind of transparency is critical as well, that every business has some kind of licensing and some licensing, not for overregulation, but just to ensure minimum safety and security of the host community should be part of that.
Did you want to comment on that, before I take another question?
It's very complicated. I mean, there are certain company confidentiality, things that aren't necessary to know, that you want to protect them to keep them competitive. There's prisoner privacy issues. It's a real complicated area, but I don't believe that if it's being paid by the government, that they should not be held to reasonable transparency standards.
Okay, do we have other questions? Yes, sir.
I guess for Caroline, what are some of the, obviously you're not, you don't like the privatization idea. So how are a detainee's human rights more ensured if they were in a state-run facility rather than privatized? And then I assume that your argument would be that there are. Do you think that those are human rights that the taxpayers would be willing to pay for? Because it sounds like it would come down to a cost issue.
Great questions. So again, I'm not going to say woohoo ICE detention or woohoo Arizona Department of Corrections. I think that's another point of agreement, is that many of these systems have some serious problems that need to be addressed. My concern is that then when you add another that are languishing in our states, like education and healthcare, that's where I'd like to be going.
Any other final thoughts from any of the other panelists? And then I think our time's about up.
Well, I would just say that as Arizona's incarceration rate went up during the 2002 to 2008-9, our crime rate went dramatically down. Now, obviously, and this is a university, so we have to say, clearly correlation is not causation. But at first glance, the increase in incarceration coincidental with decrease in crime suggests that there are other factors, but the increase in incarceration rate probably had a great deal to do with it. So I don't think you can just say it's a one-on-one thing. And the final line is the appropriations committee chair that I want to say is, there is a limited pot of money the government has to spend. There's only so much you can tax people. And the more we give to one area, the less we have for other areas. And there were times when I've been an advocate. I remember when I first got to Fountain Hills, I'm on the Parks and Recreation Commission. And my whole focus was getting money for Parks and Recreation. I was the Parks and Recreation Commissioner. I got to get money for trails. I got to get money for bike paths. And I could never understand why the council wouldn't give me so much until I got on the council. And then I discovered that there's more than just Parks and Rec asking me for money. And I've got to dole out money, limited amount of cash, to a whole lot of different groups. So everyone doesn't get what they want, and a lot of people get upset by that. But that's simply the nature of government. There's a limited amount of money to give out, and there's usually more needs than money.
We haven't touched on this yet, but included in this whole conversation are these minimum expectations. I mean, we've been talking about optimizing, visualizing a civil detention system. But at the other side, there are minimum standards, and in ICE, given the paucity of case law, to the extent that there are standards, they've been promulgated largely by ICE, and they're predicated on correctional standards. The American Bar Association has promulgated its own standards as well, dealing with civil detention, and they're outside and worthy of a hard look. Having said all of that, it's not a one-size-fits-all, and that when government takes on an enterprise, it has to do it at least to a minimum level of acceptability. And some individuals, in this case in custody, by virtue of their risks and/or their needs, they're going to cost more, and some are going to cost less. And it's our obligation when we take it on to take it on with all of the intent to do it at least to the minimum acceptable levels.
Great. Well, this, I think, has been a really interesting set of exchanges on a very important set of issues. Thank you all again for being here on this Friday afternoon, and I hope you'll join me in thanking our panelists for their participation.
Okay, so we've got a 10-minute break, so folks
Where do
can
you
come back.
where do you live now?
35.
Ooh, oh, is that where you got your, okay, that's pretty neat. Yeah, you have a cell phone?
Actually,
I meant to ask this.
just cut myself.
So do you have a pier, or do you have one of those little buoys?
I'm on Water Street, but I really can't launch much over here, but there's 4 marinas.
Yeah, that's a neat area. I envy the fresh seafood you get here. Nice to see you again. Yeah, no, that's great to meet you. That's how you get to the truth. Yeah, if you have any questions, I can put in contact with you. And if you look at it, each thing you do, cost of the reduced medical care. So I mean, we just put it different. But if you see something missing,
and the overall
yeah, well, there's
all the farm workers.
there's plenty of blame.
Didn't want an actual program for guest workers.
Yeah.
Instead, they wanted whatever.
Yeah, and we got some good guest work. Univ has got a great guest work program.
They do actually.
Yeah. Well, they use people on the other side of the border. They got buses that bring them over to work. Yeah, for the vegetables. Well, no, it's the growers. So they come in the morning on buses. They even have like medical clinics for them, and then they go back.
That's it.
Yeah, they have it. Okay, my question. I take it.
So my question is, why wasn't this somebody from Washington here to answer why is the state doing a program? I mean, I feel like we should go out. The people in Minnesota, whatever, have the public education company, we're not able to take our Arizona board back to the arts and charge us the tax. We've got more money here.
There's one way to do it, but yeah, it's a tough issue.
Baby boomers did that's why I'm raising up the pay for Social Security.
But we just, I mean, I'm just, so you're right. In many ways, there's a very Republican with social. Yeah, people making a buck off of it. Yeah. data on what the rules are.
Yeah, I mean, it's one of those things that just, you know, just like, to me, you know, but, you know, I'm very
And my dad is very
Yeah, but I would tell you, because I went to Stagny, I think you must know him. He's a straight shooter, you know, there's Campbell, you know, nobody says he's biased or anything. And I just said to him, take the TLC study and take into account the construction costs. And he explains what they do. They do that construction costs by taking all their facilities out 40 years. Yeah, you can keep it. And some of the facilities have no debt left. There's zero debt. So they put that in their factor. What we're talking about is it cheap for us to do a new prison public or private? Well, we're going to be taking on the full debt. Yeah, we're going to take the full debt on. So I said, factor that in, but the pension's the big cost. That is the lump sum. Well, it's not going to break Arizona. We aren't as bad as some states and cities. But it's gonna start to really pipe into our benefits, our appropriations to other areas in another couple of years. Just, we're gonna start doing
that's all we're doing for, you know, you look at what we spend, it's a percentage of the budget.
So, I mean, I think it's important is that much more multi-agency. We're a port city.
I'm just talking about your whole pensions everywhere. Pensions are gonna kill this state. I mean, if Moody says you don't use a reasonable, like 5% projection for return, if you don't do that,